Hello, my name is Ambree, and I'm here to talk about vaccine hesitancy, which exists on a spectrum and is the refusal of vaccines despite availability. Specifically, my topic is COVID-19 vaccine hesitancy among adults in the United States. Here in the United States, we've had over 46 million confirmed COVID-19 cases and over 751,000 related deaths, also according to the same source from Johns Hopkins. This gives us a crude death rate of about 1.62%. Part of the progressive return to normal from the COVID-19 pandemic has been the speedy development of vaccines. There are 3 available in the United States, the Pfizer-BioNTech, now known as Comirnaty, and Moderna mRNA vaccines, and the Johnson & Johnson, aka Janssen, viral vector vaccine. This map of the United States, not including the territories, shows varying rates of vaccine coverage from 44% in Wyoming to over 79% in Washington, D.C. This research was a narrative review of relevant literature published in 2021, specifically excluding 2020 due to the rapidly changing information environment. Other inclusion criteria were studies published in peer-reviewed journals, discussion of risk communication related to COVID-19 vaccines, and discussion of interventions for and determinants of COVID-19 vaccine hesitancy. For determinants, studies were used only if they had a nationally representative sample. 2 databases were searched, PubMed Central and the Cumulative Index to Nursing and Allied Health. The literature showed that females are more likely to be hesitant. Gender identity was not examined in the majority of studies. Blacks or African Americans were more likely to be hesitant all across the United States. Residents in conservative-leaning states or Republican political affiliation predicted greater hesitancy. Notably, social determinants of health, including lower income and less educational attainment, were associated with less acceptance or greater hesitancy. This may be related to lack of trust in public institutions, which emerged as a major theme in the literature related to risk communication and recommendations for interventions. Safety concerns, values, consistency, credibility, and empathy were also major themes in these areas. The findings of this research are likely limited due to recent vaccine mandates. More research is needed to examine the impacts of these mandates on vaccine uptake, public attitudes, and trust. Trust is not freely given, but earned, and it must be earned and maintained continuously. Every instance of communication is another opportunity to strengthen or erode public trust. Addressing social determinants of health, such as education, income, and healthcare access and quality, may increase vaccine acceptance and save lives. Thank you, and please do not hesitate to talk to your healthcare provider about COVID-19 vaccination.